Is intravesical therapy an effective UTI treatment? Imagine a treatment that delivers medicine directly where it's needed most, right inside the bladder. That's what intravesical therapy offers, especially for people suffering from frequent urinary tract infections. It involves inserting a small tube into the bladder and instilling medication directly through a catheter. This method allows high concentrations of antibiotics, like gentamicin, to act locally, targeting bacteria without spreading throughout the body. Because of this targeted approach, side effects are usually minimal, and systemic absorption is low. Research shows that intravesical antibiotics can significantly cut down the number of infection episodes. For example, some studies report a drop from nearly 5 infections per person to just 1 after treatment. It also helps reduce bacteria that are resistant to multiple drugs, which is a growing concern with recurrent infections. Patients often notice improvements in symptoms such as pain and urgency, making this a promising option for those who struggle with persistent UTIs. Safety is another important aspect. Most people tolerate intravesical gentamicin well, with few side effects. Mild discomfort during catheterization might occur, but serious adverse reactions are rare. Importantly, because the medication stays localized in the bladder, it doesn't usually cause gastrointestinal issues or vaginal infections, which can sometimes happen with oral antibiotics. Compared to taking pills regularly, intravesical therapy can be a good alternative, especially for patients who need frequent treatment or have trouble with oral medications. It's particularly useful for people who perform clean intermittent catheterization, as it can help prevent infections without the need for continuous antibiotics. However, it's not a first-line treatment for everyone and is generally considered after other options have been tried. While current evidence is encouraging, more large-scale studies are needed to confirm long-term benefits and to develop standardized protocols. Cost and accessibility are also factors to consider, as this treatment requires specialized equipment and trained healthcare providers. In the context of bladder health, intravesical therapy offers a focused approach that can help reduce antibiotic use and resistance, which benefits overall bladder function. But it's important to note that in patients with bladder cancer, treatments like bacillus calmette-guerin therapy are used, and antibiotics can sometimes interfere with these cancer treatments. That's why managing antibiotics carefully is crucial for patients with bladder cancer. Overall, intravesical therapy is a safe and effective option for managing recurrent urinary tract infections, especially when other treatments haven't worked. It should always be used under medical supervision, and patients are encouraged to discuss their specific situation with healthcare professionals to find the best approach for their bladder health.